afternoon, everyone, and thank you for coming. My name is Michelle Hewitt, and I am leading the public information efforts for El Paso County Public Health. We are joined again by elected community leaders, as well as experts from local public health and hospitals. Today's message to the public will address an update on COVID-19 in our community. Our speakers today are Chair of the El Paso County Board of Commissioners, Mark Waller, and El Paso County Public Health Medical Director, Dr. Robin Johnson. In attendance, we also have El Paso County Public Health Deputy Director and Incident Commander Deanne Ryberg, El Paso County Public Health Regional Epidemiologist Marini Klaber, Dr. David Steinbrunner, the incoming Associate Chief Medical Officer for UC Health Memorial Hospital, Dr. Mike DeStefano, Chief Medical Officer from Children's Hospital, Dr. Bill Plouth, Chief Medical Officer for Penrose St. Francis Health Services, and Dr. Stein Bronsky, Medical Direction for 911 Authority. They will be available to answer any questions. Also in attendance today, we have Colorado Springs Mayor John Suthers and members from Colorado City Council, to include Council President Richard Skorman. From the El Paso County Board of Commissioners, we have Commissioner Lajinos Gonzalez. We also have Jim Reed from the Pikes Peak Regional Office of Emergency Management, Colorado Springs Fire Department Chief Ted Colas, and Colorado Springs Fire Department Chief Jamie McConaughey. With that, I will pass it to Commissioner Waller to start.
Thank you, and thank you everybody for being here today. Since our press conference yesterday, El Paso County Public Health has received notification that an individual, a male in his 40s, has tested positive for COVID-19 here in El Paso County. But even with this recent development, we urge citizens to remain calm. At this time, we are recommending for citizens to go about their daily lives while continuing to take the simple steps we've talked about to prevent this and other diseases. Remember, you are your best defense against this virus. Please continue utilizing the hygiene practices recommended by El Paso County Public Health and the CDC. Briefly, these are: thoroughly wash your hands for at least 20 seconds. Cover coughs and sneezes with a tissue or your inner elbow shirt sleeve. Avoid close contact with anyone with cold or flu-like symptoms. Stay at home if you're sick. Avoid touching your eyes, nose, and mouth. And finally, clean and disinfect surfaces frequently. You do those things, that's the best defense you can possibly have to prevent the spread of this disease. El Paso County and our regional partners within the city of Colorado Springs, the health department, and area hospitals remain diligent in our combined mission to protect and inform the public. We will continue monitoring the situation, and we will continue providing information and direction as necessary. In a brief moment, I'm going to turn this over to our public health officials for their message and to answer your questions, but just a couple of things here. With this case today, it's important now more than ever to remain calm and stay close to credible sources of information. Also, we must remember that there's a real person behind this COVID-19 outbreak here in El Paso County. We wish him the best and pray for a full and speedy recovery there. Now I'm going to turn it over to Dr. Johnson with the Health Department.
Good afternoon. I'm Dr. Robin Johnson, Medical Director of El Paso County Public Health. As Commissioner Waller has stated, we have our first presumptive positive case of COVID-19 in El Paso County. The individual is a male in his 40s with a recent travel history to California. At the onset of his symptoms, he immediately self-isolated. As his symptoms progressed, he sought medical care, calling ahead prior to getting care and tested. El Paso County Public Health is working closely with the Colorado Department of Public Health and Environment to identify close contacts and continue the active investigation. As any contacts are identified, County Health will reach out to them to discuss their potential risk. Please know we will contact anyone of concern. Our team is in contact with the patient to ensure we have a complete picture of his travel, contacts, and movements, and at this time, the patient remains in isolation with identified family members under quarantine. Our response continues to be streamlining the consistent and accurate information, allocation and collaboration of resources and agencies, and you can join us in this by remaining calm. As your county health department, our #1 concern is community health. And as citizens, we ask you to join with us in this, as Commissioner Waller stated, by practicing respiratory etiquette and hygiene. Please wash your hands frequently, cover your mouth and nose if you have a sneeze or a cough. Avoid touching your face, mouth, or nose. Clean surfaces frequently, and you can just use your regular household cleaners. Stay home if you're feeling sick, and avoid others who are feeling sick. For the second priority that we have for our health is actually our healthcare providers. And this ranges from emergency medical services to our nurses and doctors and their staff. So please call for information to address your concerns with your primary care. Make sure that you're in conversation with them. If you're having any fever, cough, or shortness of breath, call ahead to your provider for directions before you're seeking evaluation so that they can prepare to see you safely. And please reserve all calls to 911 for emergencies and give full details of your concerns to the dispatch as you're speaking with them. We are also reiterating that it's important to know sources of information, that they are reliable. As one of these, El Paso County Public Health has website details of further reliable resources that are available, and you can find those resources there. As there is also CoHelp, which is available for discussion of questions. The number for that is 1-877-462-2911. That is also available on our website. The last thing is that we ask you to prepare. Know what you will do in the event that you need to stay home. And it would probably be 2 weeks. So make sure you have food, medicines, and then the logistics of daily life covered. If you are sick with anything, whether it be the flu, a cold, or anything else, please avoid congregate settings and carefully plan travel plans so that you do not infect others. We are grateful as El Paso County Public Health to continue in serving you and El Paso County. I also want to thank our partners here with me on stage who are collaborating to assure that we are caring for our community as citizens and individuals, but also as a population. And we are available for questions at this time. Thank you. I guess I will spearhead those, and then we can, yes, that's okay. So what we do know about influenza is that it is known to us. We know that it cycles yearly in a flu season. We are still in the middle of flu season. The preventive measures that we described for coronavirus are the same, and we would ask you to continue those. In addition to the flu, we actually have the opportunity to get a vaccine. We still will be considering flu season going into May, so it's not too late to get your flu vaccine, and that would be timely and appropriate. We'd ask you to go ahead and do that. Yes. So we know that this patient had recent travel to California, and we are investigating his contacts, and we'll be reaching out to anyone who would be in that category. Sure. So the question was whether this patient traveled internationally, and no, he did not. So the question was how many other people are being quarantined, and at this time his family members are quarantined, and any other contacts that we identify will be notified to have their risk assessed by county health. Yes, as soon as he recognized that he was feeling poorly and had a fever, he self-isolated. I can't actually speak to that, I'm sorry. I don't have access to those numbers right off. Those numbers have been changing. So I'm sorry, I needed to repeat the question. So the question was, in comparison, how many flu cases have been identified in El Paso County so far this season? And that number is changing rapidly. I think Marity may have that answer for us.
So just to understand from an epidemiological perspective, what does get reported to us in El Paso County or to any public health department are only cases of flu that are actually hospitalized in a given year and pediatric deaths. At this point in time, we are in the middle of flu season, but we have hundreds of flu cases at this point in time that have been reported as hospitalized.
That's actually a really good question. So the question is this: of those patients who have symptoms, how many do we anticipate will actually call to be evaluated, knowing that COVID-19, 80 to 83% of those cases will be really mild, like any other cold. And so I actually can't necessarily predict that. I think it will be interesting as we move out of this to understand maybe that portion of the population. The most important thing that I would reiterate is, in the midst of this, if you do have symptoms that you are concerned about, cold symptoms, the most important thing is that if you want to discuss it with your doctor about the severity and when it would be appropriate to be tested, to give them a call and have that conversation. And then if there is getting to a point where you and your physician decide that it's time for an evaluation or something further to be done, then you can make a plan together to do so in a way that protects not only you, but their staff and anyone else that might come in contact. So part of this is that would be hypothesizing, and so I'm sorry. The question. Thank you for reminding me. The question was, why are we seeing a sudden cases pop up here in Colorado, and whether that could be due to access to the test and how we're testing. And I believe that much of that would be hypothesizing. We have seen, though in other areas, that the spread of this virus has followed a similar pattern. So I don't know that it's just due to testing or that it's actually due to spread. The main thing that we do know is that we are poised to work with our health agencies in evaluation and then response. Yes. So the question was, who is more at risk for complications from COVID-19? And what are some pre-existing conditions that might lead someone to maybe have more concern? We do know that at this point, the COVID-19 can be contracted by pretty much everyone in the community, so we want to be protecting everyone, whether child, adult, or elderly. The elderly are at more risk than other population subgroups for a severe or complicated course. And we know those who have some immunocompromise would be The other thing is if you have other medical conditions such as diabetes, heart disease, lung issues, asthma, and COPD, you would want to, again, be perhaps a little more early in the conversations you have with your physician, just due to the underlying health. Yes. I'm going to let Marini speak to that from the epidemiology side.
The individual returned to Colorado at the end of February and traveled through DIA. That this patient has not been hospitalized ever.
The question is, we hear that it doesn't affect children very much, and do we know why that is? We don't know exactly why that is, but we do know that they can still get COVID-19. It's just that it may present more like the simple cold. And so it may be that we're not getting as many tested because they aren't as sick. As far as the details as to why, we'll be investigating that as we move forward. Yeah, so the question was, since we had our press conference yesterday to talk about staying calm and what to do, which is really that respiratory hygiene and etiquette, as well as, the prevention and then promotion with really good, accurate information, and the preparation of making sure that we have a plan of what we would do if we need to stay home. I think none of that goes out the window. All of that is even more important as we step into this more as a live exercise. And in addition to that, I would reiterate that we really ask you to really be speaking with your primary care to address those concerns. And if you have fever, cough, shortness of breath, to call ahead to your providers so that you can have directions when you're seeking evaluation. Again, we really want to protect our agencies that need to be able to care for us if we were to become more ill, knowing that most of us can stay home and take care of this in the comfort of our home, even if we do have a cold. We want to make sure that those who do need further attention have access to individuals who are healthy enough to care for them. And please reserve those calls to 911 for emergencies. And then if you do feel that you need to have access to 911, give the full details of your concerns to dispatch so that they have preparation for the EMS teams that might need to respond. And the same would go for police and the sheriff as well. So our understanding, and we have not gotten to test this yet, but our understanding is that we will get a result from the CDC within 24 to 48 hours. So, at this time, that's 24 to 48 hours as well. So I'm going to allow our Deputy Director to speak to that, Deanne Ryberg.
Thank you for that question. As we've mentioned, our response to this initial case will be based on the epidemiologic investigation that we are currently undertaking, and that investigation will guide our response to any recommendations that we may make. So as we investigate this process, we will be keeping our public informed of any changes, but it would be premature at this point to say that we are making a blanket statement regarding any changes. We are continuing with our previous recommendations.
No, I'm sorry, I'm not understanding the question. Okay, so the question was, since there has been this gentleman that tested positive, are we focusing on a particular area in the county for our investigation? The answer to that is a little more complicated than just looking at a geographic area. It really is around contact investigation. So there's a lot of details that go into that. Our epidemiologists are speaking with the patient to discuss, where he's been, but also who he's been in contact with. And so that can vary, and we will be reaching out to anybody who would be of concern so that we can discuss the potential risk and what would be next steps. And so it's not just purely geographic. Yes, sir. So I'm going to, again, refer to Marini.
This individual was not symptomatic while they were traveling. They became symptomatic after returning to El Paso County. I do not have that information, no.
We'd like to thank everyone for attending. I wanted to again share the general number for the public. If you have questions, we really encourage you to contact CoHelp at 1-877-462-2911. Public Health and our partners are committed to providing timely, accurate information, and we will continue to share updates with you as information becomes available. Thank you.